Well, taking a break a little bit from food and seafood to talk now with Dr. Andrew Greene with the Neuroscience Group. Good morning.
Good morning.
Nice to meet you.
Thank you. Thanks for having us.
You bet. Now, first of all, that's a big word, neuroscience.
Yes, it is.
And what are you guys about? What do you do?
Well, basically, we provide comprehensive care to brain, spine, and pain. So we have neurologists, neurosurgeons, I'm orthopedic spine, and we also have pain doctors, physical therapists, and occupational therapy. So we offer all the gamuts, all the non-operative and the surgical modalities to any type of brain problem, spine problem, chronic pain. We can pretty much manage it all.
It's amazing how many, I think so many people have pain and just think, well, that's the way my life's going to have to be. But there are so many ways out there, new ways to treat pain, and you know, I'm sure you've seen so many success stories that.
Absolutely, and they keep coming out with new, innovative ways to treat pain, and definitely getting rid of someone's pain is a life changer for a lot of people.
I think that's another thing. People are afraid to have the surgery because of downtime. So today you brought along some things, and we're going to talk about minimally invasive spine surgery. What is that, and who would be a candidate for that?
Well, minimally invasive spine surgery is basically treating the same spine problems that we've been treating for years, just that the technique is a little bit different. So rather than a traditional midline incision, these surgeries involve an incision on the side, and they typically involve a tube. So I use this tube, and this is a typical 60 millimeter in length, and they come in all different sizes. And through this tube, then I access the area of the spine that I need to get to, and then I have longer instruments, and I kind of work through this tube. I have magnifying glasses, and I have a headlight to illuminate the field, and that's the main difference. So. And
what's the benefit of that rather than the old way to do the surgery?
Well, in my mind, the biggest benefit is because I only have to make an incision big enough in the skin to put this tube in. The dissection is much smaller, so the postoperative pain is much less. So they require less narcotics, and the hospital stay is much shorter. So that's number one. Number two, the infection rate is much lower because you're not having to do a big dissection.
Sure.
So when you remove this tube, you just leave behind nice viable tissue that's less prone to be infected.
Mm-hmm.
Also, the blood loss is much less. So the risk of a transfusion is much lower.
So all sorts of benefits, really.
Yeah, absolutely.
Now, what is this? Explain what this is.
Well, let me start over with this one. This one is basically this is a model of someone lying on their stomach,
okay.
And so this is supposed to be their skin.
Okay.
So this is, if you can get an idea, this would be a traditional midline incision if you're going to do a fusion.
Okay.
And so for the MIS, you just need a small incision off to the side.
What a difference that makes, yeah.
And then you access, remove the bone, remove the disc, whatever you need to do to get rid of the pain. And then once you're done with that, if it's a fusion, then you can see here, this is a tower attached to a screw. So everything runs off of these guide wires, okay? So then you have screws that have holes in them. And so once you get the guide wire where you need it, you just insert the screw, okay? And then you screw it into the bone, like this. So this would be a fusion from the back. And once you have that, you can remove this inserter. You can remove the guide wire, and you're left with two towers that are above the skin. So this, obviously, I don't have to see much. I don't have to do a big dissection because it allows me to work above the skin without seeing really low.
Very cool. Wow.
And then, if you have to, once you put the screws in, you have to put in a rod. Okay. So this is a typical rod, and you're able to pass it all underneath the skin from above, and then you're left, this is the end product. So you got 4 screws and 2 rods.
And this person now is feeling way better?
Well, yeah, I mean, yeah, for the right problem and the right patient, absolutely.
I mean, tell me about that, for somebody who's had this done.
Well, I think it's definitely, like I said, it's a life changer for someone who's in chronic pain, a lot of leg pain, back pain, they have trouble walking, they've been through the gamut of the non-operative course. And this allows you to decompress, free up that nerve, which nerve pain is very excruciating. I don't know if you never had it. I never had it, but my father's had it, and he said it's very, very bad. And then a lot of times you have instability in the spine, then you have to fuse. So not everybody needs a fusion, but if you have instability, then you fuse, and that stabilizes the spine, and that gets rid of their pain.
How can people who are at home right now saying, you know, I do have some kind of pain, at least I want to find out more information, what's out there? How can people find you?
Well, I mean, obviously the internet is the best way to find us. And
because you've got lots of locations.
Yeah, lots of locations. Did I say? Yeah, so our main office is in Neenah. Did I say this?
No,
okay.
Now you have.
Okay, and we also access Green Bay. So I'm in Green Bay a lot. And then I personally go to Berlin and Marinette. So we try to definitely expand our services because it's hard for people to drive, and especially with the wintry conditions here. But yeah, otherwise, our website is neurosciencegroup.com. And you can get our main office number, and everything runs through our Neenah office. So if you need an appointment, there's not a special number for Berlin or Marinette or Green Bay. It all goes through our Neenah office.
And bottom line is, if you have some sort of pain, you know, track them down, get answers. You may not have to live with it. It could be as easy as one of these procedures that you've talked about. Thanks so much, Doctor.
Thank you very much.
Dr. Andrew Greene from the Neuroscience Group. We'll be back. We're going to do some more Cajun cooking. This time we're doing steak and lobster and béarnaise sauce, and it's going to be really good, so stay with us.